Welcome to Part 8 of our 862-question NCLEX-RN 2026 practice series. In this video, you'll complete questions 451 to 550, featuring realistic NCLEX-style practice questions designed to strengthen your clinical judgment, improve critical thinking, and reinforce essential nursing knowledge. Challenge yourself by answering each question before the correct answer is revealed. Then review the detailed explanations to understand the reasoning behind every answer and boost your confidence for exam day. Keep practicing, stay motivated, and let's continue your journey toward NCLEX-RN success. Question 451. A client has been uncomfortable in crowds all her life. After the birth of her child, she has been housebound unless her husband can accompany her to the grocery store and for medical appointments. His schedule will not allow for this, and he has insisted that she must be more independent. Her anxiety has increased to the point of panic. The client has been diagnosed with agoraphobia. Which statement is true about this disorder? A. The behavior is not considered disabling. B. More men suffer from agoraphobia than women. C. The fears are persistent, and avoidance is used as the coping mechanism. D. Agoraphobia moves into remission when treated with chlorpromazine. Answer: C. The fears are persistent, and avoidance is used as the coping mechanism. Explanation: A. Agoraphobia is the most pervasive and serious phobic disorder. B. Women compose 70–85% of agoraphobia sufferers. C. Agoraphobia is an acute disorder that immobilizes the sufferer with extreme anxiety. D. Chlorpromazine is not a drug used to treat phobias. Question 452. A 22-year-old single woman was admitted to the psychiatric hospital by her mother, who reported bizarre behavior. Except for going to work, she spends all her time in her room and expresses concern over neighbors spying on her. She has fears of the telephone being bugged. Her diagnosis is schizophrenia. One nurse per shift is assigned to work with the client. The primary reason for this plan would be to A. Protect her from suicide. B. Enable her to develop trust. C. Supervise her medication regimen. D. Involve her in groups for social interaction. Answer: B. Enable her to develop trust. Explanation: A. Suicide is a greater risk in depression than in schizophrenia. B. The client is suspicious and needs help to develop trust, which is basic to her improvement. C. Although she will be taking medication, drug therapy would not necessitate consistency in the nurses assigned. D. A suspicious client should have limited exposure to groups, because group participation increases discomfort. Question 453. A client returns to the cardiovascular intensive care unit following his coronary artery bypass graft. In planning his care, the most important electrolyte the nurse needs to monitor will be A. Chloride. B. HCO3. C. Potassium. D. Sodium. Answer: C. Potassium. Explanation: A. Chloride, HCO3, and sodium will need to be monitored, but monitoring these electrolytes is not as important as potassium monitoring. B. Chloride, HCO3, and sodium will need to be monitored, but monitoring these electrolytes is not as important as potassium monitoring. C. Potassium will need to be closely monitored because of its effects on the heart. Hypokalemia could result in supraventricular tachyarrhythmias. D. Chloride, HCO3, and sodium will need to be monitored, but monitoring these electrolytes is not as important as potassium monitoring. Question 454. The nurse needs to be aware that the most common early complication of a myocardial infarction is A. Diabetes mellitus. B. Anaphylactic shock. C. Cardiac hypertrophy. D. Cardiac dysrhythmia. Answer: D. Cardiac dysrhythmia. Explanation: A. Diabetes mellitus is not a common complication of myocardial infarction. B. Anaphylactic shock is an allergic reaction. C. Cardiac hypertrophy is a late potential complication. It is a common complication of congestive heart failure. D. Myocardial infarction causes tissue damage, which may interrupt electrical impulses. Myocardial irritability results from lack of oxygenated tissue. Question 455. The physician prescribes a medical regimen of isoniazid, rifampin, and vitamin B6 for a tuberculosis client. The nurse instructs the client that B6 is given because it: A. Increases activity of isoniazid. B. Increases activity of rifampin. C. Improves nutritional status. D. Reduces peripheral neuropathy. Answer: D. Reduces peripheral neuropathy. Explanation: A. Vitamin B6 does not enhance the activity of isoniazid. B. Vitamin B6 does not enhance the activity of rifampin. C. A vitamin alone does not improve nutritional status. D. Isoniazid leads to vitamin B6 deficiency, which is manifested as peripheral neuropathy. Question 456. Because a client is taking an MAO inhibitor, it is necessary to discuss the need for adherence to a low-tyramine diet. Which of the following are foods that she should avoid? A. Pickled, aged, smoked, and fermented foods. B. Fresh vegetables. C. Broiled fresh fish and fowl. D. Fresh fruits such as apples and oranges. Answer: A. Pickled, aged, smoked, and fermented foods. Explanation: A. These foods may produce elevation in blood pressure when consumed during MAO inhibition therapy. B. These foods have not been pickled, fermented, smoked, or aged. They contain very little, if any, tyramine or tryptophan. C. As long as the meat has not been aged or smoked, it is within the dietary regimen. D. Fresh fruits can be consumed as desired. However, the consumption of bananas is limited. Question 457. A 15-year-old client was diagnosed as having cystic fibrosis at 8 months of age. He is in the hospital for a course of 4 antibiotic therapy and vigorous chest physiotherapy. He has helped him to meet the desired outcome of consuming a prescribed number of calories by: A. Including the client in planning sessions to select the type of meal plan and foods for his diet. B. Working with the nutritionist to devise a diet with significantly increased calories. C. Selecting foods for the client's diet that are high in calories and instituting a strict calorie count. D. Constantly providing him with chips, dips, and candies, because the number of calories consumed is more important than the quality of foods. Answer: A. Including the client in planning sessions to select the type of meal plan and foods for his diet. Explanation: A. The adolescent knows what he likes and will be more likely to eat if he has some control over his diet. B. The nurses and nutritionist can plan an excellent diet, but it will not help the adolescent unless he eats it. C. Eating is already a chore for this client. Adding a strict calorie count could make it even more burdensome. D. Fats are particularly difficult for the cystic fibrosis client to digest. He does need a healthful diet, not just more calories. Question 458. A client is hyperactive and not sleeping. She will not remain at the table during mealtime. She is getting very limited calories and is using a lot of energy in her hyperactive state. The most therapeutic nursing action is to: A. Insist that she remain at the table and eat a balanced diet. B. Order a high-calorie diet with supplements. C. Provide nutritious finger foods several times a day. D. Offer to go to the dining room with her and allow her to open the food and inspect what she eats. Answer: C. Provide nutritious finger foods several times a day. Explanation: A. The client is not able to sit for long periods. Forcing her to remain at the table will increase her anxiety and cause her to become hostile. B. This action will not ensure that the client eats what is ordered. Dietary orders are not within the nurse's scope of practice. C. Providing finger foods increases the likelihood of eating for hyperactive persons. They may be eating on the run. D. These clients are not suspicious of the food or insecure in moving about the unit alone. Question 459. Which of the following blood gas parameters primarily reflects respiratory function? A. PCO2. B. CO2 content of the blood. C. HCO3. D. Base excess. Answer: A. PCO2. Explanation: A. The lungs are responsible for regulation of CO2, and this parameter primarily reflects respiratory function. B. CO2 content of the blood is an indirect measure of respiratory function. C. HCO3 is a measure of kidney function only and is important in acid-base balance. D. Base excess represents the excess of HCO3 and is not reflective of respiratory function. Question 460. The serial 7's test is often used to determine delirium and dementia. This test aids in assessing which of the following? A. Abstract thinking. B. Ability to focus and concentrate thoughts. C. Judgment. D. Memory. Answer: B. Ability to focus and concentrate thoughts. Explanation: A. This answer is incorrect. The test measures the abilities to concentrate and calculate. The use of proverbs is the most common way to test abstraction. B. This answer is correct. The serial 7's test is a common test of calculation ability. It is difficult for the demented or delirious client to perform. C. This answer is incorrect. The test for judgment should predict whether the individual will behave in a socially accepted manner. D. This answer is incorrect. In testing memory, the nurse would attempt to get the client either to recall recent events or to think about past events. Question 461. The physician prescribes amitriptyline, Elavil, for a client. What does the patient need to know about this medication? A. Prolonged use of this medication will result in extrapyramidal side effects. B. When the medication is effective, he will experience no anxiety. C. The medication should relieve his symptoms of depression. D. Blood must be drawn weekly to test for toxicity. Answer: C. The medication should relieve his symptoms of depression. Explanation: A. Phenothiazines cause extrapyramidal symptoms. B. No amount of medication can relieve all anxiety in all cases. C. The purpose of amitriptyline is to relieve the symptoms of depression because it is an antidepressant. It increases the action of norepinephrine and serotonin on nerve cells. D. Periodic blood tests are done when lithium is prescribed. Question 462. A postoperative TURP client returns from the recovery room to the general surgery unit and is in stable condition. 1 hour later, the nurse assesses him and finds him to be confused and disoriented. She recognizes that this is most likely caused by A. Hypovolemic shock. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. Answer: D. Hyponatremia. Explanation: A. Early signs of hypovolemic shock include hypotension, tachycardia, tachypnea, pallor, and diaphoresis. B. Early signs of potassium depletion include muscular weakness or paralysis, tetany, postural hypotension, weak pulse, shallow respirations, apathy, weak voice, and electrocardiographic changes. C. Early signs of an elevated sodium level include dry oral mucous membranes, marked thirst, hypertension, tachycardia, oliguria or anuria, anxiety, and agitation. D. This answer is correct. Important early clinical findings of a decreased sodium concentration include confusion and disorientation. Hyponatremia can occur after a TURP because absorption during surgery through the prostate veins can increase circulating blood volume and decrease sodium concentration. Question 463. A 67-year-old postoperative TURP client has hematuria. The nurse caring for him reviews his postoperative orders and recognizes that which one of the following prescribed medications would best relieve this problem. A. Acetaminophen suppository 650 mg. B. Meperidine 50 mg IM. C. Promethazine 25 mg IM. D. Aminocaproic acid, Amicar, 6G/24HR. Answer: D. Aminocaproic acid, Amicar, 6G/24HR. Explanation: A. Acetaminophen, Tylenol, has analgesic and antipyretic actions approximately equivalent to those of aspirin. It produces analgesia possibly by action on the peripheral nervous system. It reduces fever by direct action on the hypothalamus heat-regulating center with consequent peripheral vasodilation. It is generally used for temporary relief of mild to moderate pain, such as a simple headache, minor joint and muscle pains, and control of fever. B. Meperidine is a narcotic agonist analgesic with properties similar to morphine except that it has a shorter duration of action and produces less depression of urinary retention and smooth muscle spasm. It is used for moderate to severe pain, for a preoperative medication, for supportive anesthesia, and for obstetrical analgesia. In a postoperative TURP client, it would be used in conjunction with other medications for relief of moderate to severe pain, but not specifically for bladder spasms associated with TURP surgery. C. Promethazine hydrochloride is an antihistamine, antiemetic preparation. It exerts anti-serotonin, anticholinergic, and local anesthetic actions. It is used for symptomatic relief of various allergic conditions, motion sickness, nausea, and vomiting. It is used for preoperative, postoperative, and obstetrical sedation and as an adjunct to analgesics for control of pain. D. This answer is correct because aminocaproic acid is prescribed specifically for hematuria. Aminocaproic acid is excreted in the urine. The nurse should be alert for possible signs of thrombosis, particularly in the extremities. Question 464. A 28-year-old client performs a long, involved ritual in getting up and preparing for the day. He became unable to get to his job before noon. His family, in desperation, has admitted him to the hospital's psychiatric unit. On the unit, he is always late for breakfast, which his approach to this problem is to A. Allow him to eat late. B. Suggest that he do the rituals after breakfast. C. Get him up early so that he can complete the ritual before breakfast. D. Ask him to get all the other clients up so that he will forget about his ritual. Answer: C. Get him up early so that he can complete the ritual before breakfast. Explanation: A. Allowing him to eat late is not a solution to the problem because the ritual affects more than just this meal. B. He is helpless to change this behavior because the rituals occur as a result of an irrational effort to control his anxiety. C. To interfere with the ritual will increase anxiety. Until the basic problem is resolved, and in turn his need for the ritual relieved, arrange the schedule so that essential activities may be included, such as meals with the group. D. This approach would be very disruptive to the other clients and would not serve to relieve the anxiety of the client. Question 465. A child becomes neutropenic and is placed on protective isolation. The purpose of protective isolation is to A. Protect the child from infection. B. Provide the child with privacy. C. Protect the family from curious visitors. D. Isolate the child from other clients and the nursing staff. Answer: A. Protect the child from infection. Explanation: A. The child no longer has normal white blood cells and is extremely susceptible to infection. B. There are more appropriate ways to provide privacy, and there is no need to protect the child from healthy visitors. C. Visitors and visiting hours may be at the client's and/or family's request without regard to the isolation precaution. D. The child may have strong positive relationships with other clients or staff. As long as proper precautions are observed, there is no reason to isolate her from them. Question 466. A client is to have a coronary artery bypass graft performed in the morning using a saphenous vein. He wants to know why the physician does not use the internal mammary artery for his bypass graft because his friend's physician uses this artery. The nurse tells the client that the internal mammary artery A. Takes more time to remove. B. Has a greater risk of becoming reoccluded. C. Is smaller in diameter. D. Has too many valves. Answer: A. Takes more time to remove. Explanation: A. It does take more time to remove the internal mammary artery, and this is one reason why some physicians do not use it. B. There is not a greater risk of reocclusion. In fact, it may actually stay patent longer. C. The internal mammary artery is actually larger in diameter than the saphenous vein. D. The internal mammary artery does not have too many valves. Question 467. When caring for a postoperative cholecystectomy client, the nurse assesses patency and documents drainage of the T-tube. The nurse recognizes that the expected amount of drainage during the first 24 hours postoperatively is A. 50 to 100 milliliters. B. 200 to 300 milliliters. C. 300 to 500 milliliters. D. 1000 to 1200 milliliters. Answer: C. 300 to 500 milliliters. Explanation: A. During the first 24 hours after surgery, the drainage is normally 300,500 milliliters and then decreases to about 200 milliliters in 24 hours during the next 34 days. B. This range is the amount of drainage after the first 24 hours postoperatively. During the first 24 hours, it is 300 to 500 milliliters. C. During the first 24 hours after surgery, this range is the expected amount of drainage. D. The expected amount of drainage during the first 24 hours is 300,500 milliliters. An output of NGT, 500 ml should be reported to the physician, because an occlusion of some type, caused by a retained gallstone or an inflammatory process within the biliary drainage system, is evident. Question 468. Decreased pulmonary blood flow, right-to-left shunting, and deoxygenated blood reaching the systemic circulation are characteristic of A. Tetralogy of Fallot. B. Ventricular septal defect. C. Patent ductus arteriosus. D. Transposition of the great arteries. Answer: A. Tetralogy of Fallot. Explanation: A. Tetralogy of Fallot is the most common cyanotic heart defect, which includes a VSD, pulmonary stenosis, an overriding aorta, and ventricular hypertrophy. The blood flow is obstructed because the pulmonary stenosis decreases the pulmonary blood flow and shunts blood through the VSD, creating a right-to-left shunt that allows deoxygenated blood to reach the systemic circulation. B. A VSD alone creates a left-to-right shunt. The pressure in the left ventricle is greater than that of the right, therefore, the blood will shunt from the left ventricle to the right ventricle, increasing the blood flow to the lungs. No deoxygenated blood will reach the systemic circulation. C. In patent ductus arteriosus, the pressure in the aorta is greater than in the pulmonary artery, creating a left-to-right shunt. Oxygenated blood from the aorta flows into the unoxygenated blood of the pulmonary artery. D. Transposition of the great arteries results in two separate and parallel circulatory systems. The only mixing or shunting of blood is based on the presence of associated lesions. Question 469. A 33-year-old client was brought into the emergency room unconscious, and it is determined that surgery is needed. Informed consent must be obtained from his next of kin. The sequence in which the next of kin would be asked for the consent would be: A. Parent, spouse, adult child, sibling. B. Spouse, adult child, parent, sibling. C. Spouse, parent, sibling, adult child. D. Parent, spouse, sibling, adult child. Answer: B. Spouse, adult child, parent, sibling. Explanation: A. Spouse and adult child would be asked before a parent. B. The order of kin relationship for an adult, as determined from legal intestate succession, is usually spouse, adult child, parent, sibling. C. Parent and sibling would be asked after adult child. D. Spouse and adult child would be asked before parent. Sibling would be asked last. Question 470. Home care instructions for the child following a cardiac catheterization should include: A. Notify the physician if a slight bruise develops around the insertion site. B. Use sponge bathing until stitches are removed. C. Give aspirin if the child complains of pain at the insertion site. D. Keep a clean, dry dressing on the insertion site for 2 days. Answer: B. Use sponge bathing until stitches are removed. Explanation: A. A small bruise may develop around the insertion site and is not a reason for alarm. B. It is best to keep the child out of the bathtub until the sutures are removed. C. Acetaminophen, not aspirin, is the drug of choice if there is pain at the insertion site. D. The insertion site should be kept clean and dry and open to air. Question 471. A 32-year-old female client is being treated for Guillain-Barré syndrome. She complains of gradually increasing muscle weakness over the past several days. She has noticed an increased difficulty in ambulating and fell yesterday. When conducting a nursing assessment, which finding would indicate a need for immediate further evaluation? A. Complaints of a headache. B. Loss of superficial and deep tendon reflexes. C. Complaints of shortness of breath. D. Facial paralysis. Answer: C. Complaints of shortness of breath. Explanation: A. Headaches are not associated with Guillain-Barré syndrome. B. Loss of superficial and deep tendon reflexes is expected with this diagnosis. C. Complaints of shortness of breath must be further evaluated. 40% of all clients have some detectable respiratory weakness and should be prepared for a possible tracheostomy. Pneumonia is also a common complication of this syndrome. D. Facial paralysis is expected and is not considered abnormal. Question 472. A client has ascites, which is caused by: A. Decreased plasma proteins. B. Electrolyte imbalance. C. Decreased renal function. D. Portal hypertension. Answer: A. Decreased plasma proteins. Explanation: A. A decrease in plasma proteins causes a decrease in intravascular osmotic pressure resulting in leakage of fluid into peritoneal cavity. B. Fluid and electrolyte imbalance may occur as a result of the ascites. C. Ascites is a result of hepatic malfunction, not renal malfunction. D. Portal hypertension causes esophageal varices, not ascites. Question 473. On the first postpartal day, a client tells the nurse that she has been changing her perineal pads every half an hour because they are saturated with bright red vaginal drainage. When palpating the uterus, the nurse assesses that it is somewhat soft, 1 finger breadth above the umbilicus and midline. The nursing action to be taken is to A. Gently massage the uterus until firm, express any clots, and note the amount and character of lochia. B. Catheterize the client and reassess the uterus. C. Begin 4 fluids and administer oxytocic medication. D. Administer analgesics as ordered to relieve discomfort. Answer: A. Gently massage the uterus until firm, express any clots, and note the amount and character of lochia. Explanation: A. Gentle massage and expression of clots will let the fundus return to a state of firmness, allowing the uterus to function as the living ligature. B. A distended bladder may promote uterine atony, however, after determining the bladder is distended, the nurse would have the client void. Catheterization is only done if normal bladder function has not returned. C. Oxytocic medications are ordered and administered if the uterus does not remain contracted after gentle massage and determining if the bladder is empty. D. The client is not complaining of discomfort or pain, therefore, analgesics are not necessary. Question 474. A 48-year-old female client is going to have a cholecystectomy in the morning. In planning for her postoperative care, the nurse is aware that a priority nursing diagnosis for her will be high risk for A. Knowledge deficit, B. Urinary retention, C. Impaired physical mobility, D. Ineffective breathing pattern. Answer: D. Ineffective breathing pattern. Explanation: A. The client may have a knowledge deficit, but reducing the risk for knowledge deficit is not a priority nursing diagnosis postoperatively. B. The client will have a Foley catheter for a day or 2 after surgery. Urinary retention is usually not a problem once the Foley catheter is removed. C. A client having a cholecystectomy should not be physically impaired. In fact, the client is encouraged to begin ambulating soon after surgery. D. Because of the location of the incision, the client having a cholecystectomy is reluctant to breathe deeply and is at risk for developing pneumonia. These clients have to be reminded and encouraged to take deep breaths. Question 475. A client is going to have a pneumonectomy in the morning. She had a previous negative surgical experience, is talking rapidly, and has an increased pulse and respiratory rate. Nursing interventions for this client should include A. Providing opportunities to ask questions and talk about concerns. B. Providing distractors such as reading or watching television. C. Telling her that she should not be so nervous and assuring her that everything will be okay. D. Reminding her that this surgery is not as extensive as her past surgery was. Answer: A. Providing opportunities to ask questions and talk about concerns. Explanation: A. This intervention will help to clarify any misunderstandings about the surgery and give the client an opportunity to verbalize concerns about the surgery. B. Distractors will not alleviate the preoperative anxiety that the client is experiencing. This response actually denies the client's anxiety. C. This intervention is false assurance and denies that anxiety is a normal response to the threat of surgery. D. Psychological responses are not directly related to the extent of the surgery, because they are influenced by the client's past experiences. Question 476. A client is experiencing visual problems at school. She has complained of difficulty seeing the blackboard and squinting. She no longer likes to participate in physical activities such as softball. The client has displayed possible classic symptoms of which refractive error? A. Astigmatism, B. Hyperopia, C. Myopia, D. Amblyopia. Answer, C. Myopia. Explanation, A. Visual images are blurred and distorted. B. Symptoms are headaches, burning eyes, fatigue, squinting, and difficulty reading. C. These symptoms are classic for myopia. D. Amblyopia is not a refractive error. It is a loss of vision in one or both eyes. Question 477. A 9-month-old infant was diagnosed with non-organic failure to thrive. During her hospitalization, primary nurses were assigned to initiate all infant feedings. The infant's parents question why they cannot feed their own child. Which of the following responses would be most appropriate by the nurse? A. By assigning the same nurses to the child, the nurses can begin to learn the infant's cues and feeding behaviors. B. The same nurses will prevent parental fatigue and frustration. C. The same nurses will prevent infant fatigue and frustration. D. Primary nurses will ensure privacy. Answer, A. By assigning the same nurses to the child, the nurses can begin to learn the infant's cues and feeding behaviors. Explanation, A. Consistent primary care nurses can better interpret infant cues and note feeding behaviors. B. In non-organic failure to thrive, the parent-infant dyad has already experienced difficulties in the relationship. These parents may already feel dissatisfied and frustrated. The primary nurse would be unable to prevent this. C. Assigning a primary nurse does not ensure that infant fatigue and frustration will not occur or can be prevented. D. Providing privacy does not ensure a change in feeding behavior. Question 478. A client had a ruptured abdominal aortic aneurysm that was repaired surgically. Her postoperative recovery progressed without complications, and she is ready for discharge. Client education and preparation for discharge began 7 days ago on her admission to the nursing unit. Evaluation of nursing care related to client education is based on evaluation of expected outcomes. Which statement made by the client would indicate that she is ready for discharge? A. I will not drive but ride in the front seat of the car with a seat belt on for my first doctor's appointment. B. When I bathe tomorrow morning, I will be very careful not to get soap on my incision. C. I am allowed to exercise by walking for short periods. D. Teach my husband about the diet. He'll be doing all the cooking now. Answer, C. I am allowed to exercise by walking for short periods. Explanation, A. Postoperatively, clients with major abdominal surgery are instructed to avoid driving, riding in the front seat, and wearing seat belts because any sudden impact may injure a fresh incision. She should ride in back seat without a seat belt. B. Clients should not sit in the tub and allow the incision to soak in water because this may predispose the client to infection. A short, cool shower would be preferable. Allowing soap to come in contact with the incision would not harm it and is frequently used as postoperative wound care at home on discharge from the hospital. C. Activity instructions include, avoid sitting for long periods and get exercise by walking. Lifting more than 5 pounds of weight is also prohibited. D. The client must also learn her diet. Her husband cooking is probably a temporary measure unless he did the cooking prior to her hospitalization. A statement such as this may indicate the need for further exploration of feelings regarding her illness, dependence, and self-care expectations. Question 479. A male client was diagnosed 6 months ago with amyotrophic lateral sclerosis, ALS. The progression of the disease has been aggressive. He is unable to maintain his personal hygiene without assistance. Ambulation is most difficult, requiring him to use a wheelchair and rely on assistance for mobility. He recently has become severely dysphasic. Nursing interventions for dysphagia would be aimed toward prevention of A. Loss of ability to speak and communicate effectively. B. Aspiration and weight loss. C. Secondary infection resulting from poor oral hygiene. D. Drooling. Answer, B. Aspiration and weight loss. Explanation: A. Loss of ability to speak is not dysphagia. Although the client may have difficulty communicating, alternative measures can be developed to enhance communication. This goal, while important, is of a lesser priority. B. Dysphagia is difficulty swallowing, which could result in aspiration of food and inability to eat, causing weight loss. C. A secondary infection could result from poor oral hygiene, which could enhance the client's inability to eat, but this goal is of a lesser priority. D. Drooling normally occurs in clients with amyotrophic lateral sclerosis and may require suctioning. Drooling, while aggravating for the client, does not pose an immediate danger. Question 480. A 67-year-old man had a physical examination prior to beginning volunteer work at the hospital. A routine chest X-ray demonstrated left ventricular hypertrophy. His blood pressure was 180/110. He is 45 pounds overweight. His diet is high in sodium and fat. He has a strong family history of hypertension. The client is placed on antihypertensive medication, a B determined by A blood pressure reading of 130/70 with a 5 pounds weight loss. B. No side effects from antihypertensive medication and an accurate pill count. C. No evidence of increased left ventricular hypertrophy on chest X-ray. D. Serum blood levels of the antihypertensive medication within therapeutic range. Answer: A blood pressure reading of 130/70 with a 5 pounds weight loss. Explanation: A blood pressure within acceptable range best demonstrates compliance, but weight loss cannot be accomplished without adherence to medication, diet, and exercise. B. Absence of side effects does not indicate compliance with medication. Pill counts can be misleading because the client can alter pill counts prior to visit. C. Left ventricular hypertrophy is not an accurate measure of compliance because hypertrophy frequently does not decrease even with pharmacological management. D. Therapeutic blood levels measure the drug level at the time of the test. There is no indication of compliance several days before testing. Question 481. In working with mental health clients who are prescribed medication that must be taken on a routine basis, it is important for education to begin when the drug therapy is initiated. One of the first steps in the teaching process is to A. Explain the side effects of the medication. B. Discuss the danger of overmedication. C. Distribute written material to supplement verbal instructions. D. Explore the client's perception regarding medication therapy. Answer: D. Explore the client's perception regarding medication therapy. Explanation: A, B, C. The nurse must first obtain information regarding the client's perception of the medication regimen. D. The first step in the teaching process is to determine the client's perception. Question 482. A 19-year-old male client arrived via ambulance to the emergency room following a motorcycle accident. He is comatose. His face has evidence of dried blood. On assessment, the nurse notes an obvious injury to his left eye. The preferred positioning for a client with an obvious eye injury is A. Reclining to control bleeding. B. Any position in which the client is comfortable. C. Side lying, either left or right. D. Sitting with head support. Answer: D. Sitting with head support. Explanation: A reclining position can cause a penetrating object to advance further into the eye. B. Prevention of further injury is the priority, not comfort. C. A side-lying position may increase intraocular and intracranial pressure if an accompanying head injury is suspected. D. A sitting position with the head supported will prevent further injury while allowing injury care to take place. Question 483. A client has a history of alcoholism. He is currently diagnosed with cirrhosis of the liver. The nurse would expect him to be on which type of diet? A. High protein and high calorie. B. High calorie and high carbohydrate. C. Low fat 2G sodium diet. D. High protein and high fat. Answer: B. High calorie and high carbohydrate. Explanation: A. A high-protein diet is contraindicated in hepatic disease. B. High carbohydrates provide high caloric content to prevent tissue catabolism. C. A low-fat 2G sodium diet is a cardiac diet, however, a low-fat diet would be beneficial. D. A high-protein and high-fat diet is contraindicated in hepatic disease. Question 484. A common complication of cirrhosis of the liver is prolonged bleeding. The nurse should be prepared to administer A. Vitamin C. B. Vitamin K. C. Vitamin E. D. Vitamin A. Answer: B. Vitamin K. Explanation: A. Vitamin C does not directly affect clotting. B. Vitamin K is a fat-soluble vitamin that depends on liver function for absorption. Vitamin K is essential for clotting. C. Vitamin E does not directly affect clotting. D. Vitamin A does not directly affect clotting. Question 485. A client's behavior is annoying other clients on the unit. He is meddling with their belongings and dominating the group. The best approach by the nurse is to A. Seclude him in his room. B. Set limits on his behavior. C. Have his medication increased. D. Ignore him and tell the other clients that these behaviors are due to his illness and that they should understand. Answer: B. Set limits on his behavior. Explanation: A. This action by the nurse would be punitive. B. Consistent limit setting will help the client to know what is acceptable behavior. C. This action is not within the nurse's scope of practice. D. This could be dangerous to the client and to others and violates other clients' rights. Question 486. The nurse is notified that a 27-year-old prima gravida diagnosed with complete placenta previa is to be admitted to the hospital for a cesarean section. The client is now at 36 weeks gestation and is presently having bright red bleeding of moderate amount. On admission, the nursing intervention that the nurse should give the highest priority to is A. Shave the client's abdomen and arrange her lab work. B. Determine the status of the fetus by fetal heart tones. C. Start N4 infusion in the client's arm. D. Insert an indwelling catheter into her bladder. Answer: B. Determine the status of the fetus by fetal heart tones. Explanation: A. These nursing actions are necessary prior to the cesarean section, but not immediately necessary to maintain physiological equilibrium. B. Determining the physiological status of the fetus would constitute the highest priority in evaluating and maintaining fetal life. C. These nursing actions are necessary prior to the cesarean section, but not immediately necessary to maintain physiological equilibrium. D. These nursing actions are necessary prior to the cesarean section, but not immediately necessary to maintain physiological equilibrium. Question 487. The nurse is planning a reality orientation program for a group of clients with organic brain syndrome at the mental health center. Props that could be used for this program are A. Month-old magazines that are provided by volunteers. B. Large maps and posters depicting area of current residence. C. A litter of kittens for the clients to pet. D. A library of biographical books. Answer: B. Large maps and posters depicting area of current residence. Explanation: A. This answer is incorrect. Current magazines would be appropriate. B. This answer is correct. Maps of the state and town and posters that depict current events in the area are appropriate props. C. This answer is incorrect. Kittens would be appropriate for pet therapy, not reality therapy. D. This answer is incorrect. Biographies depict a past, not a present, orientation. Question 488. A client has received preoperative teaching for the vertical partial laryngectomy that he is scheduled to have in the morning. The nurse determines that the teaching has been effective when the client states: A. I know I will need special swallowing training after my surgery. B. The quality of my voice will be excellent after surgery. C. I will have very little difficulty swallowing after surgery. D. I may also have to have a radical neck dissection done. Answer: C. I will have very little difficulty swallowing after surgery. Explanation: A. A client with a supraglottic, horizontal partial laryngectomy would require special swallowing training, not a vertical partial laryngectomy. B. The quality of the client's voice will be altered but adequate for communication. C. The client will have minimal difficulty swallowing. D. A radical neck dissection may be done with a total laryngectomy, but not with a partial laryngectomy. Question 489. A 5-year-old child was recently diagnosed as having acute lymphoid leukemia. She is hospitalized for additional tests and to begin a course of chemotherapy designed to induce a remission. She is scheduled to have a bone marrow aspiration tomorrow. She has had a bone marrow test previously and is apprehensive about having another. Which of the following interventions will be most effective in relieving her anxiety? A. Explain what will take place and what she will see, feel, and hear. B. Remind her that she has had this procedure before and that it is nothing to be afraid of. C. Tell her not to worry about it, that it will be over soon and she can join her friends in the playroom. D. Give her a big hug and tell her that she is a big girl now and that she will do just fine. Answer: A. Explain what will take place and what she will see, feel, and hear. Explanation: A. Even though the child has had the procedure before, she will probably need additional explanations and emotional support. B. The fact that the child has had the procedure before and possibly found it painful or uncomfortable may increase, not relieve, her stress. C. This intervention does nothing to reassure the child and may well prevent her from expressing her feelings. D. This does not prepare the child for the test and burdens her with the expectation that she act bigger and braver than she is. Question 490. A 52-year-old client who underwent an exploratory laparotomy for a bowel obstruction begins to complain of hunger on the third postoperative day. His nasogastric (NG) tube was removed this morning, and he has an 4 of D5W with 0.45% normal saline running at 125 milliliters per hour. He asks when he can get rid of his 4 and start eating. The nurse recognizes that he will be able to begin taking oral fluids and nourishment when A. It is determined that he has no signs of wound infection. B. He is able to eat a full meal without evidence of nausea or vomiting. C. The nurse can detect bowel sounds in all 4 quadrants. D. His blood pressure returns to its preoperative baseline level or greater. Answer: C. The nurse can detect bowel sounds in all 4 quadrants. Explanation: A. The absence of wound infection is related to his surgical wound and not to postoperative GI functioning and return of peristalsis. B. Routine postoperative protocol involves detection of bowel sounds and return of peristalsis before introduction of clear liquids, followed by progression of full liquids and a regular diet versus a full regular meal first. C. Routine postoperative protocol for bowel obstruction is to assess for the return of bowel sounds within 72 hours after major surgery, because that is when bowel sounds normally return. If unable to detect bowel sounds, the surgeon should be notified immediately and have the client remain NPO. D. Routine postoperative protocol for bowel obstruction and other major surgeries involves frequent monitoring of vital signs in the immediate postoperative period, in recovery room, and then every 4 hours, or more frequently if the client is unstable, on the nursing unit. This includes assessing for signs of hypovolemic shock. Vital signs usually stabilize within the first 24 hours postoperatively. Question 491. An 80-year-old widow is living with her son and daughter-in-law. The home health nurse has been making weekly visits to draw blood for a prothrombin time test. The client is taking 5 milligrams of Coumadin per day. She appears more debilitated, and bruises are noted on her face. Elder abuse is suspected. Which of the following are signs of persons who are at risk for abusing an elderly person? A. A family member who is having marital problems and is regularly abusing alcohol. B. A person with adequate communication and coping skills who is employed by the family. C. A friend of the family who wants to help but is minimally competent. D. A lifelong friend of the client who is often confused. Answer: A. A family member who is having marital problems and is regularly abusing alcohol. Explanation: A. This answer is correct. 2 risk factors are identified in this answer. B. This answer is incorrect. Persons at risk tend to lack communication skills and effective coping patterns. C. This answer is incorrect. Persons at risk are usually family members or those reluctant to provide care. D. This answer is incorrect. This individual has a vested interest in providing care. Question 492. The primary focus of nursing interventions for the child experiencing sickle cell crisis is aimed toward: A. Maintaining an adequate level of hydration. B. Providing pain relief. C. Preventing infection. D. O2 therapy. Answer: A. Maintaining an adequate level of hydration. Explanation: A. Maintaining the hydration level is the focus for nursing intervention because dehydration enhances the sickling process. Both oral and parenteral fluids are used. B. The pain is a result of the sickling process. Analgesics or narcotics will be used for symptom relief, but the underlying cause of the pain will be resolved with hydration. C. Serious bacterial infections may result owing to splenic dysfunction. This is true at all times, not just during the acute period of a crisis. D. O2 therapy is used for symptomatic relief of the hypoxia resulting from the sickling process. Hydration is the primary intervention to alleviate the dehydration that enhances the sickling process. Question 493. A 43-year-old client is admitted to the hospital with a diagnosis of peripheral vascular disorder. She arrives in her room via stretcher and requires assistance to move to her bed. The nurse notes that her left leg is cold to touch. She complains of having recently experienced muscle spasms in that leg. To determine if these muscle spasms are indicative of intermittent claudication, the nurse would begin her assessment with the following question. A. Would you describe the intensity, duration, and symptoms associated with your pain? B. Do you experience swelling at the end of the day in the affected and unaffected leg? C. Have you had any lesions of the affected leg that have been difficult to heal? D. Do your muscle spasms occur following rest, walking, or exercising? Answer: D. Do your muscle spasms occur following rest, walking, or exercising? Explanation: A. Describing pain is an important aspect of the assessment. However, assessing activity preceding muscle spasms is equally important. B. Edema may occur with peripheral vascular disease, but it is not of particular importance in assessing intermittent claudication. C. Lesions may be present with peripheral vascular disease, but they are not an indication of intermittent claudication. D. With intermittent claudication, muscle spasms occur intermittently, mainly with walking and after exercising. Rest may relieve muscle spasms. Question 494. A client is diagnosed with Mycobacterium tuberculosis. He is placed in respiratory isolation, intubated, and receives mechanical ventilation. When performing suctioning, the nurse should A. Suction for a maximum of 20 seconds. B. Hyperoxygenate before and after suctioning. C. Suction for a maximum of 30 seconds. D. Maintain clean technique during suctioning. Answer: B. Hyperoxygenate before and after suctioning. Explanation: A. The maximum time for suctioning is 1015 seconds. B. Supplemental O2 should be administered before and after suctioning to reduce hypoxia. C. The maximum time for suctioning is 1015 seconds. D. Strict sterile technique should be used during suctioning. Question 495. A client had a transurethral resection of the prostate yesterday. He is concerned about the small amount of blood that is still in his urine. The nurse explains that the blood in his urine A. should not be there on the second day. B. will stop when the Foley catheter is removed. C. is normal and he need not be concerned about it. D. can be removed by irrigating the bladder. Answer: C. is normal and he need not be concerned about it. Explanation: A. Some hematuria is usual for several days after surgery. B. The client will continue to have a small amount of hematuria even after the Foley catheter is removed. C. Some hematuria is usual for several days after surgery. The client should not be concerned about it unless it increases. D. Irrigating the bladder will not remove the hematuria. Irrigation is done to remove blood clots and facilitate urinary drainage. Question 496. A 48-year-old client is in the surgical intensive care unit after having had 3-vessel coronary artery bypass surgery yesterday. She is extubated, awake, alert and talking. She is receiving digitalis for atrial arrhythmias. This morning serum electrolytes were drawn. Which abnormality would require immediate intervention by the nurse after contacting the physician? A. Serum osmolality is elevated, indicating hemoconcentration. The nurse should increase fluid rate. B. Serum sodium is low. The nurse should change fluids to normal saline. C. Blood urea nitrogen is subnormal. The nurse should increase the protein in the client's diet as soon as possible. D. Serum potassium is low. The nurse should administer KCl as ordered. Answer: D. Serum potassium is low. The nurse should administer KCl as ordered. Explanation: A. An elevated serum osmolality poses no immediate danger and is not corrected rapidly. B. A low serum sodium alone does not warrant changing fluids to normal saline. Other assessment parameters, such as hydration status, must be considered. C. A low serum blood urea nitrogen is not necessarily indicative of protein deprivation. It may also be the result of overhydration. D. A low serum potassium potentiates the effects of digitalis, predisposing the client to dangerous arrhythmias. It must be corrected immediately. Question 497. A client who is a breastfeeding mother develops mastitis. The clinical signs and symptoms of mastitis include A. Marked engorgement, elevated temperature, chills, and breast pain with an area that is red and hardened. B. Marked engorgement and breast pain. C. Elevated temperature and general malaise. D. Cracked nipple with complaints of soreness. Answer: A. Marked engorgement, elevated temperature, chills, and breast pain with an area that is red and hardened. Explanation: A. Mastitis is a bacterial inflammation of the breast tissue found primarily in breastfeeding mothers. The bacteria usually enter the breast through a cracked nipple, or the infection results from stasis of milk behind a blocked duct. B. With breast engorgement during breastfeeding, there may be marked breast pain. This is not necessarily a sign of infection. C. Women may become ill during breastfeeding with other bacterial or viral infections that are not related to mastitis. D. Improper care of the nipples or improper positioning of the infant during breastfeeding may result in cracked or sore nipples. Question 498. A client has been diagnosed with thrombophlebitis. She asks, what is the most likely cause of thrombophlebitis during my pregnancy? The nurse explains. A. Increased levels of the coagulation factors and a decrease in fibrinolysis. B. An inadequate production of platelets. C. An inadequate intake of folic acid during pregnancy. D. An increase in fibrinolysis and a decrease in coagulation factors. Answer: A. Increased levels of the coagulation factors and a decrease in fibrinolysis. Explanation: A. During pregnancy, the potential for thromboses increases owing to the increased levels of coagulation factors and a decrease in the breakdown of fibrin. B. An inadequate production of platelets would result in thrombocytopenia with resulting signs and symptoms of bleeding such as petechiae, hematuria, or hematemesis. C. A deficiency of folic acid during pregnancy produces a megaloblastic anemia. It is usually found in combination with iron deficiency. D. This combination would result in bleeding disorders because more fibrin would be broken down and fewer clotting factors would be available. Question 499. A successful executive left her job and became a housewife after her marriage to a plastic surgeon. She started doing volunteer work for a charity organization. She developed pain in her legs that advanced to the point of paralysis. Her physicians can find no organic basis for the paralysis. The client's behavior can be described as A. Housework phobia. B. Malingering. C. Conversion reaction. D. Agoraphobia. Answer: C. Conversion reaction. Explanation: A. A typical phobia does not result in physical symptoms, i.e., paralysis. B. Malingering is pretending to be ill. This person has a true paralysis. C. A conversion reaction is a physical expression of an emotional conflict. It has no organic basis. D. Agoraphobia is fear of public places. Question 500. A client is being discharged from the hospital today. The discharge teaching for care of her colostomy included which of the following basic principles for protecting the skin around her stoma? A. Taping a pouch that is leaking. B. Cutting the skin barrier 112 inches larger than the stoma. C. Changing the pouch only when leakage occurs. D. Using a skin sealant under pouch adhesives. Answer: D. Using a skin sealant under pouch adhesives. Explanation: A. When a pouch seal leaks, the pouch should be immediately changed, not taped. Stool held against the skin can quickly result in severe irritation. B. The skin barrier should be cut only slightly larger than the stoma, 1/2 inch. C. The client should be taught to change pouches whenever possible before leakage occurs. D. When skin sealant is used under the tape, the outermost layer of the epidermis remains intact. When no skin sealant is used, this layer is removed when the tape is removed. Question 501. A 48-year-old client is in the surgical intensive care unit after having had 3-vessel coronary artery bypass surgery yesterday. She is extubated, awake, alert and talking. She is receiving digitalis for atrial arrhythmias. This morning serum electrolytes were drawn. Which abnormality would require immediate intervention by the nurse after contacting the physician? A. Serum osmolality is elevated, indicating hemoconcentration. The nurse should increase fluid rate. B. Serum sodium is low. The nurse should change fluids to normal saline. C. Blood urea nitrogen is subnormal. The nurse should increase the protein in the client's diet as soon as possible. D. Serum potassium is low. The nurse should administer KCl as ordered. Answer: D. Serum potassium is low. The nurse should administer KCl as ordered. Explanation: A. An elevated serum osmolality poses no immediate danger and is not corrected rapidly. B. A low serum sodium alone does not warrant changing fluids to normal saline. Other assessment parameters, such as hydration status, must be considered. C. A low serum blood urea nitrogen is not necessarily indicative of protein deprivation. It may also be the result of overhydration. D. A low serum potassium potentiates the effects of digitalis, predisposing the client to dangerous arrhythmias. It must be corrected immediately. Question 502. A client who is a breastfeeding mother develops mastitis. The clinical signs and symptoms of mastitis include A. Marked engorgement, elevated temperature, chills, and breast pain with an area that is red and hardened. B. Marked engorgement and breast pain. C. Elevated temperature and general malaise. D. Cracked nipple with complaints of soreness. Answer: A. Marked engorgement, elevated temperature, chills, and breast pain with an area that is red and hardened. Explanation: A. Mastitis is a bacterial inflammation of the breast tissue found primarily in breastfeeding mothers. The bacteria usually enter the breast through a cracked nipple, or the infection results from stasis of milk behind a blocked duct. B. With breast engorgement during breastfeeding, there may be marked breast pain. This is not necessarily a sign of infection. C. Women may become ill during breastfeeding with other bacterial or viral infections that are not related to mastitis. D. Improper care of the nipples or improper positioning of the infant during breastfeeding may result in cracked or sore nipples. Question 503. A client has been diagnosed with thrombophlebitis. She asks, what is the most likely cause of thrombophlebitis during my pregnancy? The nurse explains. A. Increased levels of the coagulation factors and a decrease in fibrinolysis. B. An inadequate production of platelets. C. An inadequate intake of folic acid during pregnancy. D. An increase in fibrinolysis and a decrease in coagulation factors. Answer: A. Increased levels of the coagulation factors and a decrease in fibrinolysis. Explanation: A. During pregnancy, the potential for thromboses increases owing to the increased levels of coagulation factors and a decrease in the breakdown of fibrin. B. An inadequate production of platelets would result in thrombocytopenia with resulting signs and symptoms of bleeding such as petechiae, hematuria, or hematemesis. C. A deficiency of folic acid during pregnancy produces a megaloblastic anemia. It is usually found in combination with iron deficiency. D. This combination would result in bleeding disorders because more fibrin would be broken down and fewer clotting factors would be available. Question 504. A successful executive left her job and became a housewife after her marriage to a plastic surgeon. She started doing volunteer work for a charity organization. She developed pain in her legs that advanced to the point of paralysis. Her physicians can find no organic basis for the paralysis. The client's behavior can be described as A. Housework phobia. B. Malingering. C. Conversion reaction. D. Agoraphobia. Answer: C. Conversion reaction. Explanation: A. A typical phobia does not result in physical symptoms, i.e., paralysis. B. Malingering is pretending to be ill. This person has a true paralysis. C. A conversion reaction is a physical expression of an emotional conflict. It has no organic basis. D. Agoraphobia is fear of public places. Question 505. A client is being discharged from the hospital today. The discharge teaching for care of her colostomy included which of the following basic principles for protecting the skin around her stoma? A. Taping a pouch that is leaking. B. Cutting the skin barrier 112 inches larger than the stoma. C. Changing the pouch only when leakage occurs. D. Using a skin sealant under pouch adhesives. Answer: D. Using a skin sealant under pouch adhesives. Explanation: A. When a pouch seal leaks, the pouch should be immediately changed, not taped. Stool held against the skin can quickly result in severe irritation. B. The skin barrier should be cut only slightly larger than the stoma, 1/2 inch. C. The client should be taught to change pouches whenever possible before leakage occurs. D. When skin sealant is used under the tape, the outermost layer of the epidermis remains intact. When no skin sealant is used, this layer is removed when the tape is removed. Question 506. In the coronary care unit, a client has developed multifocal premature ventricular contractions. The nurse should anticipate the administration of A. Furosemide. B. Nitroglycerin. C. Lidocaine. D. Digoxin. Answer: C. Lidocaine. Explanation: A. Furosemide is a loop diuretic. B. Nitroglycerin is a vasodilator. C. Lidocaine is the drug of choice to treat ectopic ventricular beats. D. Digoxin slows down the electrical impulses and increases ventricular contractions, but it does not rapidly correct ventricular ectopy. Question 507. A 50-year-old depressed client has recently lost his job. He has been reluctant to leave his hospital room. Nursing care would include A. Forcing the client to attend all unit activities. B. Encouraging the client to discuss why he is so sad. C. Monitoring elimination patterns. D. Providing sensory stimulation. Answer: C. Monitoring elimination patterns. Explanation: A. The client should be encouraged to attend the unit activities. The nurse and client should choose a few activities for the client to attend that will be positive experiences for him. B. The nurse should encourage the client to discuss his feelings and to begin to deal with the depression. C. Depressed persons often have little appetite and poor fluid intake. Constipation is common. D. A calm, consistent level of stimuli is most effective. Sensory deprivation and overstimulation should be avoided. Question 508. A male client received a heart-lung transplant 1 month ago at a local transplant center. While visiting the nursing center to have his blood pressure taken, he complains of recent weakness and fatigue. He also tells the nurse that he is considering stopping his cyclosporin because it is expensive and is causing his face to become round. He fears he will catch viruses and be more susceptible to infections. The nurse responds to this last statement by explaining that cyclosporin A. is given to prevent rejection and makes him less susceptible to infection than other oral corticosteroids. B. is available at discount pharmacies for a reduced price. C. is usually not necessary after the first year following transplantation. D. may initially cause weakness, dizziness, and fatigue, but these side effects will gradually resolve themselves. Answer: A is given to prevent rejection and makes him less susceptible to infection than other oral corticosteroids. Explanation: A. Cyclosporin is the immunosuppressive drug of choice. It provides immunosuppression but does not lower the white blood cell count, therefore, the client is less susceptible to infection. B. Cyclosporin is available at discount pharmacies. The cost may be absorbed by health insurance or Medicare if the client is eligible. However, this statement does not address the entire problem verbalized by the client. C. Immunosuppressive agents will be taken for the client's entire life because rejection can occur at any time. D. These side effects do not necessarily resolve in time, however, the client may adapt. Question 509. When giving discharge instructions to a 24-year-old client who had a short arm cast applied for a fractured right ulna, the nurse recognizes the importance of telling him that the drying time for a plaster of Paris cast is approximately A. 30 minutes, B. 1 to 4 hours, C. 12 to 24 hours, D. 24 to 72 hours. Answer: D. 24 to 72 hours. Explanation: A. Synthetic cast materials harden in 315 minutes. Weight bearing is permitted in 15-30 minutes. Drying time for plaster of Paris is about 2,472 hours. B. C. Plaster of Paris cast materials are heavier than synthetic materials and require a drying time of 2,472 hours. Synthetic materials dry within 30 minutes. D. Plaster of Paris cast materials are heavier than synthetic materials and require a longer period to set and dry. Even though setting time, hardening, is only 315 minutes, the drying time for plaster of Paris is 2,472 hours. This depends on the size and thickness of the cast, exposure to air, and humidity in the air. Question 510. The nurse teaches a pregnant client that a high-risk symptom occurring at any time during pregnancy that needs to be reported immediately to a healthcare provider is A. Constipation, B. Urinary frequency, C. Breast tenderness, D. Abdominal pain. Answer: D. Abdominal pain. Explanation: A. Constipation is a result of decreased peristalsis due to smooth muscle relaxation related to changing progesterone levels that occur during pregnancy. B. Urinary frequency is a common result of the increasing size of the uterus and the resulting pressure it places on the bladder. C. With the increased vascularity and hypertrophy of the mammary alveoli due to estrogen and progesterone level changes, the breasts will increase in size and may become tender. D. Abdominal pain may be an indication of early spontaneous abortion, preterm delivery, or a placental abruption. Question 511. A post-lung surgery client is placed on a chest tube drainage system. When explaining to the family how the system works, the nurse states that the water seal bottle of a 3-bottle chest drainage system serves which of the following purposes? A. Collection bottle for drainage, B. Pressure regulator, C. Preventing accumulation of blood around the heart, D. Preventing air from entering the chest upon inspiration. Answer: D. Preventing air from entering the chest upon inspiration. Explanation: A. There is a separate collection bottle for drainage as part of a chest drainage system. B. In a 3-bottle chest drainage system, 1 bottle serves only as a pressure regulator. C. Mediastinal chest tubes prevent accumulation of blood around the heart immediately following heart surgery. D. The purpose of the water seal bottle in any chest drainage setup is to allow air out of the chest, but not back in. This negative pressure promotes lung expansion. Question 512. A client who was started on antipsychotic medication 2 weeks ago is preparing for discharge from the hospital. Compliance with the medication regimen is important despite the mild side effects encountered. In order to increase the likelihood of medication compliance, the nurse would A. Discuss the disease process and the importance of the medication in prevention of symptoms. B. Inform the client that additional side effects are to be expected and need not be reported. C. Discuss the importance of getting blood drawn weekly to determine medication therapeutics. D. Inform the client to cease taking the medication when all psychotic symptoms have cleared. Answer: A. Discuss the disease process and the importance of the medication in prevention of symptoms. Explanation: A. This answer is correct. If the client is well informed about what reactions to expect from her medication, she is more likely to follow the treatment regimen. B. This answer is incorrect. There are many side effects that are reversible by medication, and these must be reported to the nurse or physician. There are also more severe side effects, such as neuroleptic malignant syndrome, characterized by fever, tachycardia, and diaphoresis, which can be life-threatening. C. This answer is incorrect. There is no need for weekly blood tests if the drug regimen has been followed properly. D. This answer is incorrect. The client should continue the medication until the physician recommends any change in the drug regimen. Symptoms will usually reappear if medication is discontinued. Question 513. A 47-year-old client comes to the emergency department complaining of moderate flank, abdominal, and testicular pain with nausea of 4 hours duration. After physical examination and obtaining the client's history, the physician suspects urethral obstruction by calculi. The nurse realizes that the physician will order which one of the following diagnostic studies to confirm the diagnosis? A. Cystoscopy. B. Kidneys, ureter, bladder, X-ray of abdomen. C. Intravenous pyelogram with excretory urogram. D. Ureterolithotomy. Answer: C. Intravenous pyelogram with excretory urogram. Explanation: A. Cystoscopy is an endoscopic procedure that uses an instrument, a cystoscope, to visualize the internal bladder and ureter structures and to capture and remove an obstructing stone. B. Kidney, ureter, bladder X-ray is used to outline gross structural changes in the kidneys, ureter, and bladder and will determine the general location of a stone. C. An intravenous pyelogram with excretory urogram is used to visualize the kidneys, kidney pelvis, ureters, and bladder. This procedure is used specifically to determine whether urethral obstruction is partial or complete. It shows the exact location of the stone and dilation of the ureter above the stone. D. Ureterolithotomy is a surgical procedure in which the ureter is incised and the stone is manually removed because the stone is unable to pass through the ureter independently. Question 514. A 74-year-old client seen in the emergency room is exhibiting signs of delirium. His family states that he has not slept, eaten, or taken fluids for the past 24 hours. The planning of nursing care for a delirious client is based on which of the following premises? A. The delirious client is capable of returning to his previous level of functioning. B. The delirious client is incapable of returning to his previous level of functioning. C. Delirium entails progressive intellectual and behavioral deterioration. D. Delirium is an insidious process. Answer: A. The delirious client is capable of returning to his previous level of functioning. Explanation: A. This answer is correct. If the cause is removed, the delirious client will recover completely. B. This answer is incorrect. The demented client is incapable of returning to previous level of functioning. The delirious client is capable of returning to previous functioning. C. This answer is incorrect. The demented client, not the delirious client, has progressive intellectual and behavioral deterioration. D. This answer is incorrect. Delirium develops rapidly, whereas dementia is insidious. Question 515. A 65-year-old client who has a new colostomy is preparing for discharge from the hospital. As part of the instructions on colostomy care, the nurse explains to the client that to regulate the bowel, colostomy irrigation should be performed at the same time each day. The best time is A. After meals. B. Before meals. C. Every 2 hours. D. At bedtime. Answer: A. After meals. Explanation: A. Bowel movements should be regulated at a specific time each day to prevent accidents. Irrigating after meals takes advantage of the gastrocolic reflex and time of increased peristalsis, so better results may be produced. After meals is the normal time that peristalsis begins in most persons and evacuation of feces occurs. B. Irrigating before meals may cause poor results because of decreased gastrocolic reflex and decreased peristalsis. C. Irrigating a colostomy every 2 hours may produce hyperactivity of the bowel, leading to irritation and diarrhea. This would not aid in regulation of the bowel. D. If irrigation of a colostomy were done at bedtime, there is greater chance of having an accident during sleep. This would not be an advantageous practice of bowel regulation. Question 516. An expected response to sodium polystyrene sulfonate, KXylate, is A. Increase in serum magnesium. B. Increase in serum HCO3. C. Decrease in serum potassium. D. Decrease in serum calcium. Answer: C. Decrease in serum potassium. Explanation: A. Sodium polystyrene sulfonate administration will not increase serum magnesium. Hypermagnesemia is virtually unknown except for clients in renal failure. B. Sodium polystyrene sulfonate administration is not known to increase serum bicarbonate. C. Decrease in serum potassium. The expected response of sodium polystyrene sulfonate is secondary to the binding of this drug and potassium in the colon, and potassium is removed through the feces. D. Serum calcium may actually increase with sodium polystyrene sulfonate administration, especially if calcium chloride is administered concurrently with this drug. Question 517. A school-age child with asthma is ready for discharge from the hospital. His physician has written an order to continue the theophylline given in the hospital as an oral home medication. Immediately prior to discharge, he complains of nausea and becomes irritable. His vital signs were normal except for tachycardia. What first nursing actions would be essential in this situation? A. Hold the child's discharge for 1 hour. B. Notify the physician immediately. C. Discharge the child as the physician ordered. D. Administer an antiemetic as necessary. Answer: B. Notify the physician immediately. Explanation: A. Holding the child's discharge alone does not address the client's problem. B. Nausea, tachycardia, and irritability are all symptoms of theophylline toxicity. The physician should be notified immediately so that a serum theophylline level can be ordered. Theophylline dose should be withheld until the physician is notified. C. The child must be evaluated for theophylline toxicity before any discharge. D. Cause of the nausea should be investigated before the administration of an antiemetic. Question 518. An infant with a congenital heart defect is being discharged with an order for the administration of digoxin elixir every 12 hours. The parents need to be taught when administering digoxin to the infant that A. If the infant vomits within 30 minutes of the digoxin administration, repeat the dose. B. They need to mix it with formula so the infant swallows it easily. C. If the infant vomits 2 or more consecutive doses or becomes listless or anorexic, notify the physician. D. If a dose of digoxin is skipped for more than 6 hours, a new timetable for administration must be developed. Answer: C. If the infant vomits 2 or more consecutive doses or becomes listless or anorexic, notify the physician. Explanation: A. Occasionally the child may vomit. They should not repeat the dose because the amount of digoxin that was absorbed is unknown, and serum levels of digoxin that are too high are more dangerous than those that are temporarily too low. B. To ensure that the entire dose of digoxin is received, never mix it with food or formula. C. Vomiting, anorexia, and listlessness are all signs of digoxin toxicity and should be reported to the physician immediately. D. If a dose is forgotten for more than 6 hours, the nurse should advise the parents to skip that dose and to continue the next dose as scheduled. Question 519. Plans for the care of a client with an ulcer caused by emotional problems need to take into consideration that A. His priority needs are limited to medical management. B. There is no real psychological basis for his illness. C. The disorder is a threat to his physical well-being. B. He is unable to participate in planning his care. Answer: C. The disorder is a threat to his physical well-being. Explanation: A. There may be a medical emergency that takes top priority, however, the basis of the problem is emotional. B. The problem is a physical manifestation of an emotional conflict. C. The bleeding ulcer can be life-threatening. D. For a lifestyle change to occur, the client must participate in the planning of his care so that he is committed to changes that will have positive results. Question 520. A 49-year-old obese woman has been admitted to the general surgery unit with cholelithiasis. As the nurse is admitting her to the unit, she states, "The doctor said I have stones that need to be removed. Where are they?" The nurse knows that the best explanation for this is to tell her that A. There are stones present in her gallbladder. B. There are stones present in her kidneys. C. There are stones present in her common bile duct. D. There are no stones, but her gallbladder is irritated and caused her nausea, vomiting, and pain. Answer: C. There are stones present in her common bile duct. Explanation: Is the correct term used to describe the presence of stones in the is the correct term used to describe the is the correct term used to is the correct term used to describe inflammation of the gallbladder and can be associated with cystic duct obstructions from impacted stones. Question 521. A client was admitted to the hospital for a TURP. Within 48 hours of admission and 12 hours post-operatively, both the blood pressure and pulse increased. He became agitated, thought snakes were crawling on his arms and legs, and generally became unmanageable. He pulled out his fore and urinary catheter in attempt to rid himself of the snakes. He was sweating profusely. The admission nurse's notes indicated that the client admitted to having a few drinks now and then. He is probably experiencing which of the following? A. Major psychotic depression. B. Delirium tremens. C. Generalized anxiety disorder. D. Adjustment disorder with mixed features. Answer: B. Delirium tremens. Explanation: A. Symptoms of psychotic depression must exist for at least 2 weeks, and the symptoms must represent a change from previous functioning. B. Delirium tremens occur approximately on the 2nd or 3rd day following cessation or reduction of alcohol intake. Symptoms would be all those described in the situation. C. Symptoms exhibited by this client are not exhibited in clients with anxiety disorders, who manifest excessive or unrealistic worry about life circumstances for at least 6 months. D. Symptoms for adjustment disorders with mixed emotional features, e.g., depression and anxiety, are different from those exhibited by the client in this situation. Question 522. The physician has prescribed metoclopramide, Reglan. When assessing the client, the nurse would expect to find which of the following responses? A. Increase in gastric secretions. B. Increase in peristalsis. C. Disorientation. D. Drowsiness. Answer: B. Increase in peristalsis. Explanation: A. Metoclopramide does not stimulate gastric secretions. B. This response is expected with metoclopramide, in addition to increasing gastric emptying. C. Disorientation is a symptom of metoclopramide overdose. The drug should be discontinued. D. Drowsiness is a symptom of metoclopramide overdose and the drug should be discontinued. Question 523. A client has developed congestive heart failure secondary to his myocardial infarction. Discharge diet instructions should emphasize the reduction or avoidance of A. Fresh vegetables and fruit. B. Canned vegetables and fruit. C. Breads, cereals, and rice. D. Fish. Answer: B. Canned vegetables and fruit. Explanation: A. Fresh vegetables and fruits are excellent sources of essential vitamins. B. Canned and frozen foods have a high sodium content. Labels of all canned foods should be read to determine if sodium is used in any form. C. Bread, cereal, and rice are excellent sources of carbohydrates. D. Fish is an excellent source of protein. Question 524. A 15-year-old client is admitted to the adolescent unit. The nurse recognizes that encouraging a client to speak openly depends on how clearly questions are phrased. Which of the following statements is most desirable in eliciting information from an adolescent client? A. Do you get along well with your family? B. Do you communicate with your parents? C. You don't hate your family, do you? D. What is it like between you and your family? Answer: D. What is it like between you and your family? Explanation: A. B. This statement can be answered with a simple yes or no. C. This statement is asked in a negative manner and therefore has a negative connotation. D. This statement is open-ended and positively stated. Question 525. A 3-year-old child was hospitalized for acute laryngotracheobronchitis. During her hospitalization, the child was placed under an oxygen mist tent. The nurse's frequent monitoring of the child's temperature frightened her parents. Which response by the nurse would be most appropriate? A. Monitoring the temperature prevents undue chilling. B. Rapid temperature elevations can occur in children. C. Checking the temperature will prevent febrile seizures. D. Taking the child's temperature can prevent airway obstruction. Answer: A. Monitoring the temperature prevents undue chilling. Explanation: A. The refrigerated cool mist tent creates a cool, moist environment. The child as well as bedding and clothing may become dampened. Monitoring the temperature of the child will ensure warmth and prevent chilling. B. Only a low-grade fever is expected in laryngotracheobronchitis. C. Febrile seizures are not expected with the low-grade fever. D. Inflammation of the mucosal lining in the respiratory tract can cause airway obstruction. However, monitoring the child's temperature would not prevent airway obstruction. Question 526. A 26-year-old client is diagnosed with an astrocytoma, a benign brain tumor. From the nurse's knowledge of the central nervous system, the nurse knows that benign tumors A. Can be just as dangerous as malignant tumors. B. Grow more rapidly than malignant tumors. C. Do not warrant concern because they do not become malignant tumors. D. Can be removed surgically. Answer: A. Can be just as dangerous as malignant tumors. Explanation: A. Both a benign and a malignant tumor can displace or destroy nearby structures or increase intracranial pressure. B. Benign or malignant brain tumors grow at different rates depending on the type of tumor. C. Some benign tumors do become malignant tumors. D. Whether or not a tumor is operable depends on its location and the amount of damage its removal will cause. Question 527. A 25-year-old lawyer who is married with 3 young children works long hours in an effort to become a partner in the law firm. Following a recent hospitalization for a bleeding ulcer, he was referred for therapy to treat this psychophysiological disorder. On meeting with the therapist, he informed him or her that he was a busy man and did not have much time for this psych stuff. When guiding the client to ventilate his feelings, the therapist can expect him to express feelings of A. Guilt. B. Shame. C. Despair. D. Anger. Answer: D. Anger. Explanation: A. Guilt relates to depression. B. Shame is not associated with psychophysiological disorders. C. Despair relates to depression. D. Repressed anger is associated with psychophysiological disorders. Question 528. Succinylcholine chloride, anectine, is ordered prior to electroconvulsive therapy treatment for depressed clients. The nurse explains that the purpose of the drug is to A. Relax muscles. B. Relieve anxiety. C. Reduce secretions. D. Act as an anesthetic. Answer: A. Relax muscles. Explanation: A. Succinylcholine chloride relaxes muscles and decreases the intensity of the seizure. B. Succinylcholine chloride does not relieve anxiety. C. Atropine is given to reduce secretions. D. Thiamyl sodium, Suridol, or other phenobarbital preparations are used as brief anesthetics. Question 529. The nurse recognizes that a client with the diagnosis of cholecystitis and cholelithiasis would expect to have stools that are A. Clay or gray colored. B. Watery and loose. C. Bright red streaked. D. Black. Answer: A. Clay or gray colored. Explanation: A. Clients who have obstruction in the biliary tract so that bile is not released into the duodenum experience a change in stools from brown to gray or clay-colored. B. This type of stool can occur with other GI problems, such as bacterial or viral infections, and other disease problems, and is not a common finding with biliary obstructions such as cholecystitis and cholelithiasis. C. This type of stool is usually associated with a GI or bowel problem, such as lower GI bleeding, rather than with biliary obstructions. D. This type of stool is usually associated with a GI or bowel problem, such as upper GI bleeding, rather than with biliary obstructions. Question 530. A 5-year-old child is hospitalized for an acute illness. The nurse encourages the family to bring her favorite objects from home. What is the nurse's rationale? A. To reduce fear of the unknown. B. To keep the child calm. C. To establish a trusting relationship. D. To prevent or minimize separation anxiety. Answer: D. To prevent or minimize separation anxiety. Explanation: A. Objects from home do not reduce fear of the unknown. Children need explanations, reassurance, and preparation for the unknown. Also, parental presence can promote comfort and feelings of security. B. A calm, relaxed, and reassuring manner will assist in calming the child. The child's objects from home will not assist in calming the child. C. A trusting relationship is based on the quality of the nurse-client relationship. Objects from home have no impact. D. Favorite objects from home assist in creating a familiar setting. Also, these objects may prevent or minimize separation from the child's usual routine and family support. Topic 5. Question Set E. Question 531. A 26-year-old client has no children. She has had an abdominal hysterectomy. In the first 24 hours postoperatively, the nurse would be concerned if the client A. cries easily and says she is having abdominal pain. B. develops a temperature of 102°F. C. has no bowel sounds. D. has a urine output of 200 milliliters for 4 hours. Answer: B. develops a temperature of 102°F. Explanation: A. The client may be more tearful than normal due to the stress of the surgery and its implications for her future life. She would be expected to have pain following surgery. B. A temperature of 102°F indicates an infectious process. This is not a normal sequence to surgery and indicates a need for further assessment. C. The client is expected to have no bowel sounds for 2,448 hours after surgery because of the trauma to the bowel. D. Normal urine output is 30 milliliters per hour. This represents an output of 50 milliliters per hour, which is greater than normal. Question 532. A 5-year-old has just had a tonsillectomy and adenoidectomy. Which of these nursing measures should be included in the postoperative care? A. Encourage the child to cough up blood if present. B. Give warm clear liquids when fully alert. C. Have child gargle and do toothbrushing to remove old blood. D. Observe for evidence of bleeding. Answer: D. Observe for evidence of bleeding. Explanation: A. The nurse should discourage the child from coughing, clearing the throat, or putting objects in his mouth. These may induce bleeding. B. Cool, clear liquids may be given when child is fully alert. Warm liquids may dislodge a blood clot. The nurse should avoid red or brown-colored liquids to distinguish fresh or old blood from ingested liquid should the child vomit. C. Gargles and vigorous toothbrushing could initiate bleeding. D. Postoperative hemorrhage, though unusual, may occur. The nurse should observe for bleeding by looking directly into the throat and for vomiting of bright red blood, continuous swallowing, and changes in vital signs. Question 533. Newborns are routinely screened for phenylketonuria. The nursery nurse ensures that this screening test is performed. A. Immediately after birth, because the most accurate result is obtained at this time. B. After 2 to 3 days of milk ingestion. C. At 2 to 3 days of age regardless of amount of milk feedings. D. At 1 month, because the biochemical buildup of phenylalanine takes 1 month to detect. Answer: B. After 2 to 3 days of milk ingestion. Explanation: A. The infant has not ingested any protein immediately after birth, which is necessary to detect excessive serum phenylalanine. B. It is important that the infant take in 23 full days of milk or formula feedings to preclude a false negative reading. C. At 23 days of age, inadequate milk could have been ingested owing to a delay in the initial feeding. D. The biochemical buildup of serum phenylalanine is detectable after 23 days of milk or formula ingestion. Question 534. A female client at 37 weeks gestation has just undergone a non-stress test. The results were 2 fetal movements with a corresponding increase in fetal heart rate, FHR, of 15 bpm lasting 15 seconds within a 20-minute period. Her results would be classified as A. Reactive, needs follow-up contraction stress test. B. Reactive, no contraction stress test required. C. Non-reactive, needs follow-up contraction stress test. D. Non-reactive, no contraction stress test required. Answer: B. Reactive, no contraction stress test required. Explanation: A. A contraction stress test is unnecessary following a reactive, normal, non-stress test. B. The results are considered reactive, indicating that the fetus is not showing distress. Therefore, a contraction stress test, which is a more in-depth test for fetal distress, is unnecessary. C. A non-reactive test would show fewer than 2 fetal movements or a failure of the FHR to increase at least 15 bpm with the movements in a 20-minute period. D. A contraction stress test should follow a non-reactive non-stress test to validate fetal distress. Question 535. A 32-year-old male client is a marketing representative. His job requires him to have a tremendous amount of energy during the day. He frequently uses cocaine to sustain his energy level. Lately he has increased his use of cocaine and even experimented with crack cocaine. Realizing he can no longer continue this destructive behavior, he is seeking treatment for cocaine addiction. In planning nursing care for the client's inpatient stay, which expected outcome is most appropriate? A. He will attend 4 consecutive group educational sessions on substance abuse. B. He will name activities that he would most likely be involved in post-treatment. C. He will meet with his family in counseling sessions and discuss his feelings. D. He will be able to deal with his feelings through participation in group therapy sessions. Answer: D. He will be able to deal with his feelings through participation in group therapy sessions. Explanation: A. This expected outcome is specific as related to attendance, but not specific as related to outcome criteria. B. Stating activities does not guarantee involvement. C. This goal may help the recovery process, but post-counseling behavior is not addressed. D. This statement best describes the expected outcome. The client will be attending group therapy sessions and through them he will deal with his feelings. Question 536. A 12-year-old girl has been diagnosed with insulin-dependent diabetes mellitus. Which of these principles would best guide her nutritional management? A. Concentrated sweets are taken during increased activity. B. Food restriction is imposed to reduce weight. C. Caloric distribution should be calculated to fit activity patterns. D. Fat requirements are increased owing to the possibility of ketoacidosis. Answer: C. Caloric distribution should be calculated to fit activity patterns. Explanation: A. Concentrated sweets are eliminated from diet planning. Complex carbohydrates may be taken at the time of increased activity. B. Food restriction is not used for diabetic control of growing children. Caloric restriction may be imposed for weight control if necessary. C. Total caloric intake and proportions of basic nutrients should be consistent from day to day. Distribution of these calories should fit the activity pattern. Extra food is needed for increased activity. A balance of food, exercise, and insulin should be maintained. D. Because of the increased risk of atherosclerosis, the fat percentage of the total caloric intake is reduced. Question 537. A client has chronic obstructive pulmonary disease. She is slowly losing weight, and her daughter is very concerned about increasing her nutrition. The nurse helps the daughter devise a plan of care for her mother. The plan of care should include which of the following interventions to promote nutrition? A. Offer her oral hygiene before and after meals. B. Encourage her to consume milk products. C. Encourage her to engage in an activity before a meal to stimulate her appetite. D. Restrict her fluid intake to 3 glasses of water a day. Answer: A. Offer her oral hygiene before and after meals. Explanation: A. Clients with respiratory diseases are generally mouth breathers. Cleaning the oral cavity may improve the client's appetite, increase her feelings of well-being, and remove the taste and odor of sputum. B. Milk causes thick sputum, therefore, milk products would not be beneficial for this client. C. Exercise prior to a meal would require increased O2 consumption and most likely would decrease the client's ability to eat. D. Clients with respiratory diseases need increased fluid to liquefy secretions. Question 538. A female client has experienced varying degrees of depression throughout her life. Now that she is postmenopausal, her depression has increased. She is unable to motivate herself to clean her house or even to get out of bed and get dressed in the morning. The client was begun on fluoxetine, Prozac, therapy. When educating her about fluoxetine, what might the nurse caution her about? A. A daily dose of fluoxetine may be taken in the morning or evening. B. Fluoxetine is not sedating, therefore, restrictions on driving and other hazardous activities are not necessary. C. Rashes or pruritus usually occur early in the therapy and are treatable without discontinuing the medication. D. It is safe to take over-the-counter or other prescription medications with fluoxetine. Answer: C. Rashes or pruritus usually occur early in the therapy and are treatable without discontinuing the medication. Explanation: A. A daily dose of fluoxetine should be taken in the morning. Afternoon doses may cause nervousness and insomnia. B. Although fluoxetine is less sedating than other antidepressants, it may still cause dizziness or drowsiness in some clients. The nurse should caution clients to avoid driving or hazardous activities until the central nervous system effects of the drug are demonstrated. C. Rashes or pruritus do commonly occur early in therapy and respond to antihistamines or topical corticosteroids. D. Advise the client not to take over-the-counter or other prescription drugs without consulting with the physician. Fluoxetine does interact with other common drugs such as monoamine oxidase inhibitors, diazepam, insulin, oral antidiabetic agents, tricyclic antidepressants, and tryptophan. Question 539. A 4 days postpartum client who is Gravida 3, Para 3, ICE examined by the home health nurse during her first postpartum home visit. The nurse notes that she has a pink vaginal discharge with a serosanguineous consistency. The nurse would most accurately chart the client's lochia as A. Rubra, B. Rosa, C. Serosa, D. Alba. Answer: C. Serosa. Explanation: A. Lochia rubra is bloody with clots and occurs 13 days postpartum. B. There is no such term as lochia rosa. C. Lochia serosa is a pink-brown discharge with a serosanguineous consistency that occurs 49 days postpartum. D. Lochia alba is yellow to white in color and occurs approximately 10 days postpartum. Question 540. A female client is admitted to the emergency department complaining of severe right-sided abdominal pain and vaginal spotting. She states that her last menstrual period was about 2 months ago. A positive pregnancy test result and ultrasonography confirm an ectopic pregnancy. The nurse could best explain to the client that her condition is caused by A. Abnormal development of the embryo, B. A distended or ruptured fallopian tube, C. A congenital abnormality of the tube, D. A malfunctioning of the placenta. Answer: B. A distended or ruptured fallopian tube. Explanation: A. The embryo itself may develop normally in the first several weeks of an ectopic pregnancy. B. An ectopic pregnancy in the fallopian tube causes severe pain owing to the size of the growing embryo within the narrow lumen of the tube, causing distension and finally rupture within the first 12 weeks of pregnancy. C. The fallopian tube may either be normal or contain adhesions caused by a history of pelvic inflammatory disease or tubal surgeries, neither of which are congenital causes. D. An ectopic pregnancy does not involve a dysfunctional placenta, but the implantation of the blastocyst outside the uterus. Question 541. A normal 3-year-old child is suspected of having meningitis. The doctor has ordered a lumbar puncture. In light of this procedure and developmental characteristics of this age appropriate? A. Emphasize those aspects of the procedure that require cooperation. B. Tell the child not to cry or yell. C. Tell the child that he will get a stick in his back. D. Use medical terminology when explaining the procedure to the client. Answer: A. Emphasize those aspects of the procedure that require cooperation. Explanation: A. The nurse should emphasize what is required to elicit cooperation and help to develop a sense of autonomy. B. The child may express discomfort verbally and should be encouraged to express his feelings. C. Selecting non-threatening words to explain a procedure will prevent misinterpretation. D. When explaining the procedure to the parent with the child present, the nurse should use words that the child can understand to avoid misunderstanding. Question 542. A female client has a chest tube placed. It is accidentally pulled out of the interpleural space when she is ambulating. The first action the nurse should take is to: A. Instruct the client to cough deeply to re-expand her lung. B. Put on sterile gloves and replace the tube. C. Apply a petrolatum dressing over the site. D. Auscultate the lung to determine if she needs the tube replaced. Answer: C. Apply a petrolatum dressing over the site. Explanation: A. This action is inappropriate. Coughing will not re-expand the lung and could result in further harm. B. This action is a medical procedure, not a nursing procedure. C. An occlusive dressing will prevent further air leak until the physician institutes further treatment. D. The decision to reinsert the tube is a medical decision, not a nursing one. Question 543. A 15-year-old female adolescent is frequently breaking the rules of the unit. She has left the unit and was found smoking in the bathroom and spending a large amount of time in the male ward. Which statement by the nurse would best explain to the teenager why she must follow the rules of the unit? A. It is not easy, but the rules must be followed so that everyone can get a fair chance. B. If you do not follow the rules, you will be transferred to the closed, locked unit. C. You are not being fair to the other clients by getting them involved in your deviant behavior. D. Break the rules, all you want, but don't get caught again. Answer: A. It is not easy, but the rules must be followed so that everyone can get a fair chance. Explanation: A. This statement acknowledges that it is difficult but is not threatening or punitive. B. This statement is threatening and describes specific punishment for further deviant behavior. C. This response elicits shame by blaming her for involving others. D. This response gives her permission to break the rules but indicates that getting caught is wrong. Question 544. A male client has a history of diverticulosis. He has questions about the foods that he should eat. His nurse gives him the following information. A. He should be on a high-fiber diet. B. He should eat a low-residue diet. C. He should drink minimal amounts of fluids. D. He does not need to make any modifications. Answer: A. He should be on a high-fiber diet. Explanation: A. Clients with diverticulosis should maintain a high-fiber diet and prevent constipation with bran or bulk laxatives. B. Low-residue diets lead to constipation and are contraindicated in clients with diverticulosis. C. Clients with diverticulosis should drink at least 8 glasses of water each day to prevent constipation. D. Clients with diverticulosis should modify their diet to include high-fiber foods and bulk laxatives. Question 545. A 24-year-old graduate student recognizes that he has a phobia. He suffers severe anxiety when he is in darkness. It has altered his lifestyle because he is unable to go to a movie theater, concert, and other events that may require absence of light. The client is seeking assistance because he is no longer able to socialize with friends due to his phobia. The psychologist working with him is using desensitization. He has asked the nursing staff to assist the client in muscle relaxation techniques. What result would indicate client education has been successful? A. He enters a movie theater, sits in his chair, and replaces anxiety with relaxation as the theater darkens. B. He enters a concert, but as the lights dim, he does not experience anxiety. C. He states that he no longer fears dark places. D. He takes a part-time job as a photographic assistant. His job necessitates his working in a darkroom. Answer: A. He enters a movie theater, sits in his chair, and replaces anxiety with relaxation as the theater darkens. Explanation: A. This situation provides specific evidence that the client is able to integrate muscle relaxation technique into his lifestyle to alleviate anxiety. B. The client may not experience anxiety at the concert, but there is no evidence regarding the technique that he used to alleviate anxiety. C. The client may state he no longer experiences anxiety, but there is no evidence demonstrating this. He may be denying anxiety to discontinue therapy prematurely. D. Does he experience anxiety in the darkroom? He may have taken this job to force himself to deal with the phobia directly. Question 546. A 22-year-old client is 16 weeks pregnant. She and her husband are expecting their first baby. The client tells the nurse that her last normal menstrual period was February 16, with 3 days of spotting on February 17, 18, and 19. The nurse calculates her expected date of delivery to be A. November 23, B. December 26, C. September 14, D. December 9. Answer: A. November 23. Explanation: A. Nail's rule is as follows: add 7 days to the first day of the last menstrual period, subtract 3 months, and then add 1 year. B. Nail's rule presumes that the woman has a 28-day menstrual cycle, with conception occurring on the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons but is insignificant in the calculation of Nail's rule. C. Nail's rule presumes that the woman has a 28-day menstrual cycle, with conception occurring in the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons but is insignificant in the calculation of Nail's rule. D. Nail's rule presumes that the woman has a 28-day menstrual cycle, with conception occurring on the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons but is insignificant in the calculation of Nail's rule. Question 547. A term neonate has experienced no distress at birth and has an APGAR score of 9. Her mother has asked to breastfeed her following delivery. Immediately after birth, the neonate was most susceptible to heat loss. The most appropriate intervention to conserve heat loss and promote bonding is to A. Place her under the radiant warmer. B. Dry her with blankets. C. Place her to her mother's breast. D. Place her on a heated pad. Answer: C. Place her to her mother's breast. Explanation: A. A radiant warmer maintains an optimal thermal environment by use of a thermal skin sensor taped to the infant. The warmer limits parental attachment, so, although appropriate, it is not an intervention that promotes infant attachment. B. Warmed blankets prevent heat loss in the neonate by conduction. In addition, tactile stimuli promote crying and lung expansion. This intervention does not promote attachment, however. C. Skin-to-skin contact is an effective way to conserve heat after delivery and promotes parental attachment following birth in the healthy term infant. The first period of reactivity lasts approximately 30 minutes following birth. A strong sucking reflex and an active, awake newborn characterize this period. D. Surfaces of objects warmer than the infant promote overheating by conduction, and neonatal hyperthermia may result. Question 548. A mother brings a 6-month-old infant and a 4-year-old child to the nursing clinic for routine successful? A. Examine the 4-year-old first. B. Provide time for play and becoming acquainted. C. Have the mother leave the room with one child, and examine the other child privately. D. Examine painful areas first to get them over with. Answer: B. Provide time for play and becoming acquainted. Explanation: A. The 6-month-old should be examined first. If several children will be examined, begin with the most cooperative and less anxious child to provide modeling. B. Providing time for play and getting acquainted minimizes stress and anxiety associated with assessment of body parts. C. Children generally cooperate best when their mother remains with them. D. Painful areas are best examined last and will permit maximum accuracy of assessment. Question 549. A 44-year-old female client is receiving external radiation to her scapula for metastasis of breast cancer. Teaching related to skin care for the client would include which of the following? A. Teach her to completely clean the skin to remove all ointments and markings after each treatment. B. Teach her to cover broken skin in the treated area with a medicated ointment. C. Encourage her to wear a tight-fitting vest to support her scapula. D. Encourage her to avoid direct sunlight on the area being treated. Answer: D. Encourage her to avoid direct sunlight on the area being treated. Explanation: A. The skin in a treatment area should be rinsed with water and patted dry. Markings should be left intact, and the skin should not be scrubbed. B. Clients should avoid putting any creams or lotions on the treated area. This could interfere with treatment. C. Radiation therapy clients should wear loose-fitting clothes and avoid tight, irritating fabrics. D. The area of skin being treated is sensitive to sunlight, and the client should take care to prevent sun damage by avoiding direct sunlight and covering the area when she is in the sun. Question 550. A 40-year-old client has lived for 8 years with an abusive spouse. She married her husband in her senior year of high school after becoming pregnant. Shortly after the baby was born, he began to physically abuse her. She has attempted to leave him several times, but she has always returned. She is unable to support herself financially, and her husband threatens to kill her if she leaves him. This time, her husband has beaten her so badly she cannot stop the bleeding from the gash above her eye. She admits her husband caused her injury. In assessing a person after experiencing spousal abuse, which need has the highest priority? A. Assess the level of anxiety, coping responses, and support systems. B. Assess the history of physical abuse. C. Assess suicide potential. D. Assess drug and alcohol use. Answer: C. Assess suicide potential. Explanation: A. Assessing the level of anxiety, coping responses, and support systems is very important, but not of highest priority at this time. B. A history of physical abuse is an important part of assessment. The nurses must also always ask if there is abuse of the children. C. Although all of these answers are very important in assessment, the highest priority is assessment of suicide potential, because this could cause the greatest harm to the client. Feeling there is no other way out, abused spouses may consider suicide. D. The spouse may be self-medicating herself with alcohol or drugs to escape an awful situation. The abuser may also be abusing drugs or alcohol. If this is so, the nurse should encourage the spouse to seek counseling and not to return to the home. If you're finding this series helpful, please like, subscribe, and turn on notifications so you never miss the next episode of our complete 862-question NCLEX-RN 2026 practice series.